Today I want to talk about some of the benefits of using a suction style prosthesis and how you also don this type of prosthesis. So this is a good example of a typical suction prosthesis. Inside of the prosthesis there is a valve, or an expulsion valve it's called, that as you walk pushes air out but will let no air in. So when you have an airtight fitting socket, this will allow the suction to act, and it will hold it onto your leg and prevent pistoning and movement. So it's a popular option for those who have trouble with pin locking systems. The way that you maintain an airtight seal is with this extra sleeve. So when you have a suction prosthesis, you need a sleeve like this to make an airtight seal on the prosthetic, on your actual limb. There's some new liners out that have seals around the gel liner that can limit the use of this actual sleeve, but by and large today the majority are still using this type of sleeve. So some of the differences with a pin are obviously no pin, you have a valve inside here, and you have to wear a sleeve like this. There's another, probably the most critical part of the prosthesis, is that it's donned correctly so that you can actually get suction. So you'll see the gel liner here, and you'll put on whatever sock fits your leg best. So generally, in a suction style, you'd like to be with as few socks as possible. You can use a sheath, 1-ply, 3-ply, and up to a 5. Beyond 5 in this style, you'd really like to prevent that. So the more socks, obviously, the more air has to get has to be removed from the socket, and you don't end up with as good or as comfortable of a fit. So when it comes time to put on the prosthesis, you'll roll this sleeve down just the level of the back brim here. Okay, this sleeve has a gel material on the inside, fabric on the outside. And then you can put the limb on. You'll need to apply some force when putting it on. It needs to be a snug fit in order to work properly. So if you can slide right in, you need more socks. From this point, you'll keep your leg out straight and you'll roll this sleeve up by hand. Okay? So as this sleeve goes over the leg, you maintain your airtight seal. Okay. Now the critical part here, if you notice, this sock has to terminate just above the trim lines, but it cannot go above the gel liner. In order to get the suction, this gel has to attach or stick to this gel. So it's critical that your socks are not too long when you use this style prosthesis. So you can roll this up and just fold it over, and then you will get your nice suction seal. Now when you stand, in order to get suction, you're going to need to march in place and take a few steps. And as you walk, that air will be removed, and you'll see the trim lines actually pull in here around the brim of the socket. That will be a good indication that you have a seal. A couple important things to note are, if the valve inside gets clogged, you may need to see your clinician and clean that out. You would know that if you don't get the seal around the top here. The other thing that can happen is you can get a hole in this sleeve. If you have a hole in the sleeve, obviously air will escape and you won't have your airtight socket. So again, you would see your clinician and you can get a new sleeve. So these are the main points of donning the suction prosthesis, and also some of the benefits.